Hi, I'm Sari Cooper. I'm co-founder of Erotic Intimacy Academy, along with my co-founder,
Ghweinem.
Kelly Ghweinem. And we're here to talk about another in our series of what we wish we had known before we became certified sex therapists.
Mhm.
And today's topic will be on the issue around how to handle secrets when you're working with a couple, right?
Mhm. Yeah, I feel like this is kind of a controversial topic among like therapists, sex therapists, right? Because everyone does things a little bit differently. So we wanted today to talk about like what we used to do or how we like were taught, coming up as therapists and what we do now and why we decide to do things that way. So, Sari, how were you taught to handle secrets in your practice?
Well, so first, before I became a certified sex therapist, I had been trained at the Ackerman Institute for couples systemic therapy and
Mhm.
family therapy. And one of the ways in which was modeled for me through supervision, I would say, is that when a couple comes in and you discover or you have an inkling, first of all, I think when I first started working with couples, I didn't necessarily see them individually. There was this policy of don't see each partner individually. Why? Because a secret might come up. And then what are you going to do? You're left with that. And so I think what was taught, if in fact you kind of get a sense that there's something awry and there's a secret being kept after you've worked with them, and then it comes up, like, for example, the big secret of one of them having an affair. How do you handle it? I think earlier in my career, I must say that I was advised, or it was modeled for me, that you have to go back to the couple and say, you know, I don't think this is the right time for you right now to be in couples therapy, just from what I've gathered. And I would be happy to see you at a later time. And so you would actually end the treatment. Yeah. What about you, Kelly? What was modeled for you in supervision, or what was taught to you didactically?
Yeah, so when I was in my master's program, I took a class on couples therapy, which was what really piqued my interest in working in couples and sex therapy. But in that couples therapy class, we did talk about like what happens when secrets come up. And it was similar that if you work with a couple and a secret comes up, you either end treatment or you talk, like you don't have those individual sessions to even give a chance to talk about like how do you want to approach this um, secret or whatever, whatever the topic is, how do you want to approach that in the couple. It was like it has to come out there or you end treatment. And so I feel like that really shaped how I went into couples work early on, because I felt like, well, everything has to be out on the table. That's the best route of action, is like if, everything is talked about in the open, which is different than how I do things now, right? Like now I do have individual sessions, like I have a couple session, and then I have two individual sessions each or more if we need more. And I talk to the person if there's a secret, if there's something they don't want to share with their partner. I talk to them about why they don't want to share it. What do they feel like is going to happen if they share it? How do they want to continue to engage in therapy? And it's not my place to share that secret for them. It's about figuring out what they want to do with that secret.
Right. So part of our sex therapy model, right, is we do have these individual sessions when a couple comes in, because we do what's called a sexual history. And in that time, we find out sometimes, we'll ask, have you ever had a sexual experience or romantic experience outside of this primary relationship? And that's when we actually ask about it. It's not like we wait for it to come out. And so the question here is, how long in the past was it? How much does it pertain to the presenting issue that they're having? Also, just from a legal standpoint, right? Even though we sort of, we not sort of, we look at the couple as as a unit, as our client, if you will, from a clinical standpoint, legally, each of these partners is an individual client. And from an ethical and legal standpoint, everything that's talked about in an individual session is legally confidential, right? And so that is part of our responsibility as licensed therapists. When they tell us something that is really, so now what I do is if I find out something that is pertaining, like an infidelity that's going on right now, or, that's breaking their agreement and that the other partner would conceive of, right? Conceive of as a breaking of an exclusive agreement. I ask that person, how do you think you're going to be able to address what your couple's presenting issue is while you're still engaged with somebody else in this behavior? And I put it actually back on them to figure it out. And what I do is I ask for more individual sessions, and then I balance it with the other partner. But I do want to know from them, how are they thinking about this?
Yeah, similar. And I think, that's probably because you are my supervisor and I learned from you, right? So that's why I have that model. But I've found that framework, especially when I lay it out in the beginning. So we have our first session and I'm letting them know what to expect, right? And I'm letting them know when we have our individual sessions, everything is completely confidential. And we're going to keep that confidentiality. And I feel like that really helps with the therapeutic alignment too, because they feel a little bit freer to talk about things in session, and maybe not a secret necessarily, right? Like it might not be an infidelity secret, but sometimes people reveal feelings that they have when their partner's not present because they don't want to hurt their partner's feelings. And so that's also a very important part of like having these individual sessions. But that therapeutic alliance, then if something does come out or if it is an infidelity, that helps with, if the person says, hey, I'm ready to like talk about this in session, I don't feel like I can continue our work together unless I talk about this, because it's really important for us to be open and transparent with each other. Them having that space to process it on their own or process it in individual sessions allows them to have the best conversation in the couple session, because they're prepared for what they want to say. They don't feel like they're backed into a corner that they have to reveal this secret, or that they have to talk about it with their partner. And they've also been able to really reflect on like, what does this mean for me, right? What does this mean for my relationship, and how I'm approaching the relationship in the space that I have, with the mental and emotional space that I have to approach this relationship. And it's been, I feel like this setup too with long-term clients. Let's say I've been working with someone for 2 years and something comes up, and that ability to have the individual sessions and process things has really helped us, with several clients that I'm thinking of, get into more in-depth work and work through some of the actually presenting problems that maybe we didn't think were connected, but now like something came up and it's like, oh, this is a symptom of a larger thing that's happening within the dynamic. And so the ability to just have that confidential space within the couple space, I feel like is a really powerful tool for deeper insight oriented work.
Correct. And also, there are also, I would say, to add to that, other things that come up for sex therapists in a sex
Mhm.
therapist office that might not come up in a general couples therapist office, including interest in certain kink things, whether they go to, play parties, or they're interested in a specific type of sexually explicit media like pornography that they don't feel like they can tell their partner because they're afraid their partner would think ill of them or
Mhm.
be disdainful of them. Other things that they consider secrets, are things about past partners that
Mhm.
if their partner knew would really be upsetting to them, because they didn't tell them the whole truth of what their history was, right? So part of the work is just helping individual partners decide whether is this a secret or whether this is private.
Mm-hmm.
And so that's the way we work. And I think it might behoove people, therapists or coaches who are watching us, to understand, how did you come by the way you're doing your work? And
Mm-hmm.
how did you come to sort of conceptualize what was in the best interest of your clients and or you? Or did you just do what you learned because you thought that was the way of doing it? But in fact, it might be a blind spot. And
Mm-hmm.
so that's, we're talking about secrets today, and we have referred to secrets like infidelity. This month, our topic for our See It certification, Sexuality Educated and Erotically Informed Therapist certification, is infidelity, right? So
Mm-hmm.
that's why we're sort of focusing on that more than other secrets. But we're also trying to let you sort of brainstorm about all the different things you've held when working with a couple, or things you found out at the end of treatment, or maybe what contributed to a termination of a couple, that you wish you had done differently, or you wish you had learned about earlier, if only you had asked. And then how do you go about asking? So
Yeah.
that's what we're offering, right, in our See It certification, so that you feel more comfortable and you feel more confident in how to set up your template, your therapeutic plan. Yeah.
Yeah, because I feel like, when you're a newer therapist, or even if you've been a seasoned therapist, and someone comes in with something like infidelity, or you're working with a couple for a long time and then that pops up during your work, that's not the presenting issue. There are a lot of feelings and thoughts that therapists have on their own that could, you know, um, come into the room. And so how does that impact, like, how you're keeping secrets, or how you're addressing not keeping secrets, how you're addressing secrets, right? Because what if your own internal bias is, well, everything should be out on the table, they should know this, they should, like,
Right.
why, right? And really reflecting on that why. And I think a lovely part of our See It certification, the case consultation, is really talking about countertransference and how the therapist shows up, right? That's a big part of the consultations that we do. And this infidelity is something that brings up a lot of feelings in clinicians. And it's important that we recognize that and talk about it.
It's the thing that I get the most questions about, actually,
Mhm.
when I'm doing presentations to practices, organizations, conferences. And I would add one other thing that's a secret that comes up quite a bit is past trauma, whether it's sexual boundary crossing, whether it's sexual assault, whether it's childhood sexual abuse, whether it's, like something that happened within a family that is very icky. We ask that ick factor of, like, even if someone didn't touch you, was there a boundary crossed here? A lot of times partners will not share that information with their partner, because it's too upsetting, but it is having an impact on their sexual and intimate life.
Yeah. All right, so I guess that's all we have today for our topic.
So please, if you have questions or interests, or you want to know more information, please email us at info@eroticacademy.net, and we'd love to hear from you, or join our email list.
Mhm. Thank
And
you.
the other thing we should say is that we have ongoing enrollment in
Mhm.
our 11 month certification.
Yep.
So check us out on eroticacademy.net. Anything else?
Nope, that's it.